I'm going to be working with you today. I'm going to be your SPTA. Can I just confirm your name and date of birth?
Brenda Harper, 7/16/04.
Okay, perfect. I just want to ask you a couple questions. Do you know what day of the week it is today?
Thursday.
Okay, and then since I wasn't working with you previously, do you know what surgery you had got done?
I had total knee replacement on both of my knees.
Okay, perfect. I'm glad you were able to answer my questions. Now I know that we are able to work together and we can continue on. So today what we are going to be doing is we are going to be applying cold pack to both of your knees. The reason for this is that I know you are feeling some pain, inflammation, edema around that knee area. So I know it can be a little bit discomforting. So that is a way to manage it and the pain. And eventually it can help you later on in your treatment as well. Alright? And then before we begin, there's just a couple of factors of education that go into the cold pack. So when we apply cold packs, you will feel intense cold, burning, aching, analgesia, which is just pain relief, and then numbness. So those are going to be the stages that you go through while the cold is being applied to you, while the cold is on your skin. Okay. All right. And then what you should not feel is any new pain or itching around the area where the cold is placed. All right. And then I will be in physical contact with you, so I just want to make sure that I have consent to work with you today. Is that all right?
Yes.
Okay, perfect. I'm glad that you let me know that. So now what I'm going to do is I'm going to have you go ahead and lay down for me. And I'm going to be doing a couple of skin assessment tests on you. Is it all right if I bring
Yes.
that like that? Perfect. Okay, so I'm going to be doing a skin assessment on you just to check your knees and see how it is looking. All right, see that you have good skin condition. I'm just going to go ahead and check the temperature on both of your knees. Perfect. Okay, perfect. And now I'm going to go ahead and just test for your capillary refill, all right? Okay, perfect. Now I'm gonna go ahead and do a sensation test on you. So basically what this is it's gonna be me tapping your skin. It's going to feel a bit like this. I'm just gonna tap it on your forehead so you know exactly what it feels like. Quick tap on your skin, and that's what's going to be. If once you feel it, you say yes. So once you feel that touch, say yes. If you do not know, or you don't know if you felt it, or I don't know, you might have felt it, don't answer at all if you're unsure. All right? Okay. All right, so I'm gonna go ahead and continue, and just make sure that your eyes are closed. All right? Perfect, and relax.
Yes.
It's okay.
Yes. 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 Yes.
Okay.
Yes. 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 Yes.
Okay, perfect. You can go ahead and open your eyes for me. So you did very good. I see that you have good sensation. Your skin is ready and prepped. And then I noticed that you wanted to be able, or well, if you want to be able to replicate this at home with somebody, your caregiver, anybody who's with you at your home, you want to make sure that they do these skin assessments, making sure that your skin is intact, that there's no cuts, burns, any wounds, any of that sort, as well as making sure that your capillary refill is available in less than 3 seconds. All right. Okay. And then also just that, make sure that your sensation is intact around the area where the cold will be applied. Okay. All right. So those are just some things that the person that is with you or that is doing this on you will have to do, since you are not able to do those tests on yourself due to sensation and other factors. All right. Perfect. And then I'm gonna go ahead and get my cold pack for you. And how would you say your pain is feeling today?
Like a 4 out of 10.
4 out of 10? All right, perfect. I'm gonna go ahead and get this cold pack. So these are cold packs that we use here at the clinic. And then also, before I go ahead and apply it on your skin, The cold pack should only stay on your skin for about 10 to 15 minutes, no longer than 20 minutes, because that can cause adverse effects to your skin, which can cause tissue death, temporary or permanent nerve damage, and then it could also cause tissue death to vasoconstriction, ischemia, and thrombosis, which is just blood clotting. So we want to make sure that we avoid all of those things. And then also, these cold packs are available at any store, and once you could use things that you have at your house as well, like peas, anything that's in the freezer that's cold, and then just making sure that you're putting a layer over it, and like a pillowcase, something you can use at home. It should be good. All right. So I'm gonna go ahead and actually I'm going to place this wedge just to make sure your feet are elevated. So I'm gonna bring your feet up. And then, are you comfortable here? You need me to adjust it?
I'm good.
Okay, perfect. I'm gonna go ahead and place this on here now. And just wrap it around. You know, it might feel a little cold at first. Alright. Second one. Alright, let's go over here. Gonna wrap it around also. Okay, and then I'm gonna leave this ball right here with you. This is going to be if you feel like it's too cold, you can't deal with that anymore, you just are not feeling well, alright? Okay, so you're gonna have this bell here. If you feel too cold, you feel that numbness already, you're past those stages that I reminded you of at the beginning, you press that bell for me, alright? And then we're just gonna do this for about 10 minutes. I'll be back in about 5 minutes to check on you, alright? For sure. Perfect. Okay, perfect. It's been about 5 minutes. I'm gonna go ahead and just check how your skin is doing. How are you feeling?
Good.
Good. All right. What stage would you say you're in about right now?
Like aching.
Aching.
Yeah.
Okay, that's very good. I'm glad you remembered those stages I told you about at the beginning. I'm gonna go ahead and check the other side. Okay, looks very good. Little cold, little red, which is normal. You might get some redness after applying cold on your skin. So I'm gonna go ahead and leave it for the remaining 5 minutes. Again, if you get past that numbness stage, let me know and press that bell for me, all right?
For sure.
Perfect. Okay, perfect. It looks like our 10 minutes are up. So how are you feeling now? Still
Good.
feeling a little bit of that pain after?
No, actually the numbness just settled in.
How would you say your pain is right now on a scale of 1 to 10?
Like a 2.
2?
2 out of
Okay,
10.
perfect. I'm glad that the cold is able to help you. I'm gonna go ahead and place your legs down before I go ahead and do something else with you. So before, I'm gonna do a skin assessment again, just to make sure that the cold didn't affect you or did anything to your skin. Alright, so I'm just gonna go ahead and look around. Perfect. And just check for temperature, a little cold. And then I'm gonna go ahead and do the capillary refill again and make sure that it comes back in less than 3 seconds. Perfect. And what that is expected is some restrictions, some limitations that is preventing you from performing. Okay, just do one more. Okay, perfect. You did it very good. Now you can go ahead and sit up for me. And let me know if you need any help. Perfect. So I'm glad that that the cold was able to relieve some of your pain, and it is also going to help with some of that swelling that you were feeling. Overall, this cold is going to help you reduce that pain, get back to some things that you would like to be doing. Like I know you were having some trouble driving because of that knee pain, so this might be able to help with it, and also be able to assist you because I know you were having trouble walking and having trouble having time standing for prolonged times. So overall, this is going to keep helping you And if at any point you feel like, overall it's going to be helping you, alright? So then next time we're just gonna go ahead and do this again, and then do you have, I'm gonna do a quick test on you before I let you go about the cold. So do you remember how cold the cold patches stay on for?
Like 10-15 minutes?
Yes. No longer than 20 minutes, but about 10 to 15 minutes. And then and at home, when should your caregiver check in with you?
Like with the ice packs?
Yes.
Oh, like every 5 minutes?
Yes, correct. And then they should also be checking that your sensation in your skin, like the test that I did on you, is intact, and also your capillary refill, making sure that your blood is flowing, circulating, and that the temperature is about the same on each leg. Alright? Perfect. So those are just some of the things that you can incorporate when you go and do this at home on your own. Alright? Perfect.
Cool.
And then I'll see you next time. Alright?
Awesome. Thank you.
Perfect.